am Zach's mom, and I'm going to present the personal perspective of raising a child with attention deficit, hyperactivity, or ADHD. And I first realized that Zach might have had a problem when he was quite young, maybe 4, 5 years old, maybe even earlier, because there are certain criteria that begin to give the parent a suspicion that their child might have attention deficit. One of those being poor sleep patterns. Zach did not sleep well as a baby or a toddler. The other is multiple ear infections, which Zach had.
And how is that a trigger? What makes the ear infections a trigger?
Science isn't quite sure about that, the medical versus the developmental issue of ADHD. But with research, it was found that multiple ear infections, among other things, with the sleep pattern problem. Zachary was tardy in developmental stages, as in potty training, as in walking. And all of these issues have been researched heavily for attention deficit, and there is quite a large amount of research available, books written, articles written on these issues with attention deficit. And with that, with those couple of problems, I took that to his pediatrician, and Zach began a regime of Ritalin treatment at about 6 years old, going into first grade. His teacher felt that he was attention deficit because here again, as he goes into the social world and have to deal with a structured setting such as school, she felt that he had the symptoms, the social symptoms that can be witnessed by a teacher, by a parent, not so much a physician because they don't spend a lot of time with the child, that perhaps he might be actually tested for attention deficit. Now, the DSM of diagnostic criteria for ADHD, I won't read them all because it's a little lengthy, but the typical diagnostic criteria are often fidgets, has difficulty remaining seated, is easily distracted by external stimuli, meaning out there in the world, has difficulty waiting turn in games or groups, often blurts out answers to questions without waiting for the teacher to call on Zach, has difficulty following through on instructions, has difficulty sustaining attention in tasks, meaning they go running off. They won't sit and continue on with the single task, has difficulty playing quietly, often talks excessively. If anybody knows Zachary Wellington, they'll know he talks excessively since he was a small child. Often interrupts or intrudes on others, does not seem to listen, and there are several other things. And this has been documented in his diagnostic criteria for ADHD. Zachary had most of all of these issues going through school in his home life. We then decided, his father and I then decided that he would be officially tested. And at 8 years old, he went through 2 days of 3-hour sessions each of testing by educational psychology practice. And his results are in his evaluation, and it was definitely found that Zachary indeed is officially diagnosed with attention deficit. And from there, he was to remain on a plan of his medication, but then it became a task of me and his father to work very closely with him for behavioral issues, behavioral modification, behavioral therapy. We had, it was not going to be done by medication alone, because that's not fair to a small child to expect to pop a drug into his mouth and expect all the woes to be taken care of. Just an immediate recovery.
And as a parent, what was it described to you? Behavior modification specifically, what was that described to you by experts as, I guess just be more specific about what that meant?
I didn't get too much help from the physician except for a prescription for Zachary and renewal prescriptions for Zachary. Because I am a college educated person, and my degree was in psychology, I felt the best thing I needed to do for Zachary was to educate myself in attention deficit hyperactivity disorder. And so therefore, I got many sources, resources, books. I went to conferences, and I found out as much as I could to help Zach function in school and in social settings. Now, it was not easy. We needed to make a plan for Zach and stay consistent with the plan. For example, to get Zach to pay attention to his homework or pay attention to doing chores, we set up a token plan for Zachary. We set up a, Zach, if you do this one chore, and they had to remain simple. You could not complicate Zach by talking, words. You had to simplify it. Zach, sit and start your homework, and you will get a token. And the token would go in a jar so he could see it, and when he got so many tokens, he would get a prize. And there were, as I recall, there were prizes in a box that he could pick one, or he could go to Jimmy Cone and get an ice cream. And this went on for quite some time. And then we had to change it up because Zach got used to it and wouldn't respond to that. So we had to do something else behaviorally, because the key here is not negative reinforcement. The key is positive reinforcement. And because we worked so hard on that, I worked so hard on that, Zachary never suffered from any kind of personal identity crisis, as many attention deficit children do, because they're constantly being yelled at, sit down, sit down. They're not worked with. As I said, the child gets a pill in his mouth, and the parents and others around them feel that that should take care of, away from any of the problem, and that's far from the truth. That's far from the truth. So as Zachary developed, and he went from the one stage to the next stage, I was constantly changing his positive reinforcement. Now, and this particular book, Russell Barkley, who is foremost in understanding and writing about attention deficit hyperactivity, that became my Bible in helping Zach, helping me help Zach, and having Zach move on positively through his education, his having friends, making friends. Okay, stop. Just pause, please.